ನಮಸ್ತೆ. ಇವತ್ತು ರೇಡಿಯೋ ಸಿಟಿ ಸ್ವಾಗತಿಸ್ತಾ ಇದೆ ಡಾಕ್ಟರ್ ನವೀನ್ ಕುಮಾರ್ LV ಅವರನ್ನ. ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ಸ್ ಇಂಜುರಿ ತಜ್ಞರು ಇವರು, ಅಂಡ್ ಆಲ್ಸೋ ಸೀನಿಯರ್ ಕನ್ಸಲ್ಟೆಂಟ್ ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್ಸ್, ಸರ್ಜಾಪುರ್ ರೋಡ್, ಬೆಂಗಳೂರು. ಇವತ್ತು ನಮ್ ಜೊತೆ ಇದ್ದಾರೆ ಇವರು. ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ ಇಂಜುರೀಸ್ ಬಗ್ಗೆ ಸಾಕಷ್ಟು ಮಾಹಿತಿನ ಹಂಚ್ಕೊಳ್ಳೋದಿಕ್ಕೆ, ಟು ಎಜುಕೇಟ್ ಅಸ್ ಅಬೌಟ್ ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ಸ್ ಇಂಜುರೀಸ್. ವೆಲ್ಕಮ್ ಟು ದ ಶೋ ಸರ್.
ತುಂಬಾ ಸಂತೋಷ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಮಿಸ್ಟರ್ ಸುದೇಶ್.
ಅಂಡ್ ಹಾಗೆ ಡಾಕ್ಟರ್, ನಿಮ್ಮ ಒಂದು ಇಂಟರ್ವ್ಯೂಗೆ ತಯಾರಾಗ್ಬೇಕಾದ್ರೆ ಸ್ವಲ್ಪ ರಿಸರ್ಚ್ ಮಾಡಿದಾಗ ನನಗೆ ಗೊತ್ತಾಯ್ತು, ನೀವು ಗೋಲ್ಡ್ ಮೆಡಲ್ ನ ಗೆದ್ದಿದ್ದೀರಾ, ಜೊತೆಗೆ ಬೆಸ್ಟ್ ಟ್ರೈನಿ ಅವಾರ್ಡ್ ಅಟ್ UK, ಅಂಡ್ ಆಲ್ಸೋ ಯು ಹ್ಯಾವ್ ಟಾಪ್ ದ ಬ್ಯಾಚ್ ಅಟ್ ಇಟಲಿ, ಅಂಡ್ ಒಂದು ಡಿಸ್ಟಿಂಕ್ಷನ್ ರ್ಯಾಂಕ್ ಸಿಕ್ಕಿದೆ ನಿಮ್ಗೆ ಪೋರ್ಚುಗಲ್ ನಲ್ಲಿ ನಿಮ್ಮ ಅಡ್ವಾನ್ಸ್ ಟ್ರೈನಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್ ಆಫ್ಟರ್ MS. ಸೊ ಈ ಒಂದು ಮಾಹಿತಿನ ನೋಡಿದಾಗ ಎರಡು ಪ್ರಶ್ನೆ ನನ್ನ ತಲೆಗೆ ಬಂದಿದೆ. ಏನಂದ್ರೆ, ಫಸ್ಟ್ ಒನ್, ನಿಮ್ಮ ಈ ಒಂದು ಸಕ್ಸಸ್ಸಿನ, ಈ ಒಂದು ಯಶಸ್ಸಿನ ರಹಸ್ಯ ಏನು?
So in simple words, if I have to say, perseverance and attention to details. A lot of people may be genius people who will have the kind of capacity, but there are a lot of us who are not really born genius. But ಅದೇ ಒಂದು ನಾವು ಒಂದು ಏಮ್ ಇಟ್ಕೊಂಡು ಅದರ ಕಡೆಗೆ ಆ ದಿಕ್ಕಿನಲ್ಲಿ ಹೋಗ್ತಾ ಹೋದ್ರೆ, if we keep a goal in our mind and work towards that, ಆವಾಗ we can reach that goal. And ಅದಕ್ಕೆ ಒಂದು ಪರ್ಸಿವಿಯರೆನ್ಸ್ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ ಅದು ಬೇಕಾಗುತ್ತೆ. ಅಂಡ್ ಅಟೆನ್ಷನ್ ಟು ಸ್ಮಾಲರ್ ಡೀಟೇಲ್ಸ್. ಎಷ್ಟೋ ಸಾರಿ ನಾವೇನ್ ಮಾಡ್ತೀವಿ, ಚಿಕ್ಕದನ್ನೆಲ್ಲ ಇಗ್ನೋರ್ ಮಾಡಿ ವಿ ಟ್ರೈ ಟು ಜಸ್ಟ್ ಗ್ರೋ ಬಿಗರ್ ಅಂಡ್ ಬಿಗರ್. ಬಟ್ ಇಫ್ ಯು ಟೇಕ್ ದೋಸ್ ಸ್ಮಾಲ್ ಸ್ಟೆಪ್ಸ್ ಟುವರ್ಡ್ಸ್ ದಟ್, ಯು ಕ್ಯಾನ್ ಗೆಟ್ ದೇರ್. ವಿತ್ ಮೈ ಐ ಹ್ಯಾವ್ ನಾಟ್ ಡನ್ ಎನಿಥಿಂಗ್ ಬಿಗ್, ಬಟ್ ವಿತ್ ಮೈ ಸಿಂಪಲ್ ಥಿಂಗ್ಸ್ ಅಷ್ಟು ಹೇಳ್ಬೋದು ಅಷ್ಟೇ.
It is actually so kind of you to say that I've not done anything big anta. It's actually a big thing, sir. And ಈ ಎಲ್ಲಾ ಒಂದು ಅಡ್ವಾನ್ಸ್ಡ್ ಓವರ್ಸೀಸ್ ಟ್ರೈನಿಂಗ್ಸ್ ಎಲ್ಲ ನೀವು ಅಟೆಂಡ್ ಮಾಡಿದೀರಾ, ಬಹಳಷ್ಟು ಕಲ್ತಿದ್ದೀರಾ. ಸೊ ಇದ್ರಿಂದ ನಿಮ್ಮ ಲೋಕಲ್ ಪೇಷಂಟ್ಸ್ ಗೆ ಯಾವ ರೀತಿ ಹೆಲ್ಪ್ ಆಯ್ತು ಸರ್?
ಕನ್ನಡದಲ್ಲಿ ಒಂದು ಗಾದೆ ಇದೆ, ದೇಶ ಸುತ್ತಿ ನೋಡು, ಕೋಶ ಓದಿ ನೋಡು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು, ಆಯ್ತಾ. ವೆನ್ ಯು ಗೋ ಅರೌಂಡ್ ದ ಕಂಟ್ರೀಸ್, ಗೋ ಅರೌಂಡ್ ದ ಪ್ಲೇಸಸ್, ಯು ವಿಲ್ ಸಿ ಲಾಟ್ ಆಫ್ ವೇರಿಯೇಷನ್ಸ್. ಈಗ ನಮ್ಮಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಒಂದೇ ಕಡೆ ಕುತ್ಕೊಂಡ ಕೂಪ ಮುಂಡುಕ ಅಂತ ಹೇಳ್ತೀವಿ, ಆಯ್ತಾ. ಈಗ ಇವತ್ತು ಟೆಕ್ನಾಲಜಿಕಲಿ ವಿ ಹ್ಯಾವ್ ಇವಾಲ್ವ್ಡ್. ಡಿಜಿಟಲ್ ವರ್ಲ್ಡ್ ಅಲ್ಲಿ ಎವ್ರಿಥಿಂಗ್ ಅಂಗೈಲಿ ಅರಮನೆ ಇದೆ. ಯು ಕ್ಯಾನ್ ಅಕ್ಸೆಸ್ ದ ಥಿಂಗ್ಸ್ ವೆರಿ ಈಸಿಲಿ ನೌ ಅ ಡೇಸ್. In spite of that, especially medical world ಅಲ್ಲಿ, if we need to learn the things, we have to travel. ಯಾಕೆ ಅಂದ್ರೆ ಏನೋ ಒಂದು ಟೆಕ್ನಿಕ್ ಇರುತ್ತೆ, ಏನೋ ಒಂದು ವೇ ಆಫ್ ಡೂಯಿಂಗ್ ದ ಥಿಂಗ್ಸ್ ಇರುತ್ತೆ. ಅದನ್ನ when you see people, observe them doing, and when you train with them, then you can learn better. So ಹೀಗಾಗಿ especially in surgical field ಅಲ್ಲಿ, traveling does enrich our experiences. And when you travel, of course you meet more people, more cultures, more different kind of approaches to the thing. So adana now adopt ಮಾಡ್ಕೊಂಡಾಗ our overall approach towards the problem, towards the patient outcomes will get different, get better. So adrindagi travel ಮಾಡಿದಾಗ you can see and you can learn more ಅಂತ ಹೇಳ್ಬೋದು.
ಪರ್ಫೆಕ್ಟ್ ಡಾಕ್ಟರ್, ಪರ್ಫೆಕ್ಟ್. ಅಂಡ್ ಈಗ ನಮ್ಮ ಇವತ್ತಿನ ಟಾಪಿಕ್ ಕಡೆಗೆ ಹೋಗೋದಾದ್ರೆ ಡಾಕ್ಟರ್, ಮೊದಲನೇ ಪ್ರಶ್ನೆನ ನಾನು ನಿಮ್ ಮುಂದೆ ಇಡ್ತಾ ಇದ್ದೀನಿ. ಸೊ ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ ಇಂಜುರಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ಮತ್ತೆ ಜನರಲ್ ಆರ್ಥೋಪೆಡಿಕ್ ಸರ್ಜನ್ ನಡುವೆ ವ್ಯತ್ಯಾಸಗಳೇನು? ವಾಟ್ ಆರ್ ದ ಡಿಫರೆನ್ಸಸ್?
Okay, this is a question lot of people ask me when they come to my clinics and my OPDs, as to what is the difference ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ಯಾಕೆಂದ್ರೆ especially in India, people don't know sports injuries or sports orthopedics as a separate specialty ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. See, ಈಗ ನಾವೇನ್ ಮಾಡ್ತಾ ಇದ್ವಿ, for last 150 years, we as orthopedic surgeons have been mastering the technique of healing the bones. So both fracture fixation agirbodu, the way we do the alignment of the bones so that the fractures can heal in the right way. But there are a lot of other things which are supportive elements for the bones. ಅಂದ್ರೆ ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಲಿಗಾಮೆಂಟ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ದ ರೋಪ್ಸ್ ವಿಚ್ ಹೋಲ್ಡ್ ದ ಬೋನ್ಸ್ ಟುಗೆದರ್, ಹಗ್ಗಗಳು ವಿಚ್ ಹೋಲ್ಡ್ ದ ಬೋನ್ಸ್ ಟುಗೆದರ್. ಅಥವಾ ಈಗ ವಿ ಟಾಕ್ ಅಬೌಟ್ ದ ಮಸಲ್ಸ್ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಮಾಂಸಖಂಡಗಳೇನಿದೆ, ದೇ ಆರ್ ಸಮಥಿಂಗ್ ವಿಚ್ ಆರ್ ದ ಮೇನ್ ಯೂನಿಟ್ ವಿಚ್ ಅಲೌಸ್ ಅಸ್ ಟು ವಾಕ್ or do the movements. With just having bones, we are not going to do anything. We need all of these things. So all of these supportive structures, we need to keep them in a good condition and heal them as well. Just the bone heals andre one cannot start walking or running kind of thing. It doesn't happen. So all of these things as a unit has to work. So that is where the sports injury specialist or sports orthopedics anta en heltivi, that has evolved as a specialty now. In Western countries it's very much so. In India also it is now being taken up in a big way. So it is a kind of bridge where you take a look at the person as a whole and treat the whole of musculoskeletal system ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ. So this is the kind of next step ಅಥವಾ next level of evolution of orthopedics ಅಂತಾನೆ ಹೇಳ್ಬೋದು actually.
Okay. Thank you so much, doctor. And my next question to you is,
Yes.
ಈ ಒಂದು ಎಕ್ಸರ್ಸೈಸಿಂಗ್ ಮತ್ತೆ ಸ್ಪೋರ್ಟ್ಸ್ ಅಂತ ನಾವು ಇನ್ವಾಲ್ವ್ ಆದಾಗ, ಇಂಥ ಆಕ್ಟಿವಿಟೀಸ್ ಅಲ್ಲಿ ಇನ್ವಾಲ್ವ್ ಆದಾಗ ಕಾಮನ್ ಆಗಿ ಆಗುವಂತಹ ಶೋಲ್ಡರ್ ಇಂಜುರೀಸ್ ಯಾವ ರೀತಿ ಇರುತ್ತೆ?
They are of two broad categories. There can be a fractures around the shoulder. There are dislocations of the shoulder joint. We also see rotator cuff tear anta heltivi. These are the muscles around the shoulder which can get torn. These are all acute injuries anta helbodu, which happen due to some immediate injury. But we see a lot of people without any specific injury, but as they go on training, at some point they have picked up some subtle injuries, and that has become over a period of time a bigger problem. For example, impingement anta heltivi, andre shoulder joint olage ಇಲ್ಲಿ ಏನು ಸ್ಪೇಸ್ ಇರಬೇಕು ಫಾರ್ ದ ಮೂವ್ಮೆಂಟ್ ಆಫ್ ದ ಬೋನ್ ಅಪ್ವರ್ಡ್ಸ್, ಆ ಜಾಗ ಕಡಿಮೆ ಇದ್ರೆ ಆವಾಗ ಅದು ಪ್ರತಿ ಸಾರಿ ಕಚ್ಕೊಳ್ಳುತ್ತೆ. ಇಟ್ ಕಾಸಸ್ ಇರಿಟೇಷನ್. ಸೊ ಆ ರೀತಿ ಆಗುತ್ತೆ. ಸೊ ಸಮಟೈಮ್ಸ್ ಆಲ್ ದ joints around this area can become a bit worn out over a period of time, especially in weight trainers. So ಆ ರೀತಿ ಕೆಲವೊಂದು wear and tear related issues ಕೂಡ ತುಂಬಾಷ್ಟು ಕಾಣ್ತೀವಿ ನಾವು. So these are the two broad categories of injuries which we see. Treatment wise ಬಂದ್ಬಿಟ್ಟು both of them, the kind of treatments what we do can vary depending upon the nature of things, but lot of these things can be actually prevented. But these are the injuries we talk about when it comes to the shoulder problems.
Okay. I actually liked it, doctor. ನೀವು ಆ ಒಂದು ಮಾಡೆಲ್ ನ ತೋರಿಸಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದ್ರಲ್ಲ, it was really helpful to understand. And
Yes.
Moving on to the next question, doctor.
Yes.
ಈ ಸ್ಪೋರ್ಟ್ಸ್ ಅಲ್ಲಿ ಮತ್ತೆ ಎಕ್ಸರ್ಸೈಸಿಂಗ್ ನಲ್ಲಿ ಇನ್ವಾಲ್ವ್ ಆದಾಗ ಮಂಡಿನಲ್ಲಿ ಆಗುವಂತಹ ಇಂಜುರೀಸ್ ಯಾವ ತರ ಇರುತ್ತೆ? ವಾಟ್ ಆರ್ ದ ಡಿಫರೆಂಟ್ ಟೈಪ್ ಆಫ್ knee injuries that happen when we involve in sports and exercising?
Again, the same rule applies for this one as well. There are two broad categories when we talk about this. One is where you have a proper injury and you end up coming to an orthopedic surgeon or a sports injury specialist. So where you can have either fractures around the joint, where it can be a ligament injury, in the sense the ropes which hold the joint together, or in the center. There can be a cushion injury, meniscus anta ಏನು ಹೇಳ್ತೀವಿ, inside the joint. There can be a meniscal injury, or it can be a cartilage injury, the lining of the joint. So these are all acute injuries where people may suddenly have either the loss of support kind of feeling, athwa tumbane pain, or I'm not able to walk kind of thing. That is one category where they come with this kind of acute injuries. Or the another group which we see is much more common, where it is due to repetitive strain. Andre, if we take a pen for example, and if we do this 10 times, nothing is going to happen. If I keep on bending it thousands of times, cracks will appear. In the same way, these kind of things can happen to muscles and tendons, soft tissues around the joint as well. So what we commonly see, runner's knee anta neevu kelirbodu, the one which we commonly talk about, where people will have pain in and around the kneecap, bandi chippu, patella anta heltivi, around that area there can be pain. So that kind of things happen due to wear and tear, where the things are not freely gliding. Because of that, there will be increased stress, which causes micro tears or micro injuries in the muscles and tendons anta heltivi. Athwa ಇಲ್ಲಿ IT band anta ಒಂದು ಬರುತ್ತೆ side ಗೆ. If that band has become stiffer and tighter, then also people will be having issues with running or jogging. Particular activity ಮಾಡಿದಾಗ they will have issues due to that, and that can be very crippling for them. Yakendra they may not be able to train further because of that a particular issue.
Okay. ಈಗ ಕಂಪೇರ್ಡ್ ಟು ಶೋಲ್ಡರ್ ಇಂಜುರಿ, knee injury ಜಾಸ್ತಿ ಟೈಮ್ ತಗೊಳುತ್ತೆ ಅನ್ಸುತ್ತಲ್ವಾ ಟು heal actually, because knee takes a lot of body weight on it.
Howdu, because see, shoulder joint we can protect it, we can keep it aside for some time, that luxury we have. But when it comes to knee problems, the issue is you have to bear weight, you have to be mobile. It's not easy to be away from putting weight on the leg for long. So those things cause a bit of an issue. Moreover, as a rule of thumb, shoulder ge, upper body ge, the kind of blood circulation which is there, comparatively lower limb andre leg ge supply will be lesser. So adu one karana agutte.
And ee injuries na prevent ಮಾಡ್ಲಿಕ್ಕೆ ಆಗುತ್ತಾ doctor? Now nobody wants to get injured intentionally, ಆದ್ರೆ ಆಗ್ಬಿಡುತ್ತೆ accidentally. So ಈ ತರ ಆಗದೆ ಇರೋ ರೀತಿ ಏನಾದ್ರೂ measures ತಗೋಬಹುದಾ to prevent these kind of injuries?
Absolutely. So ಈಗ ಲಾಟ್ ಆಫ್ ಸ್ಪೋರ್ಟ್ಸ್ ಇಂಜುರೀಸ್ ನಾವೇನ್ ಕೇಳ್ತೀವಿ, they can be prevented with very simple few rules which if we follow. So ನಾನು 3-4 ಅಂತೂ ಕ್ಲಿಯರ್ಲಿ ಔಟ್ಲೈನ್ ಮಾಡ್ತೀನಿ, ವಿಚ್ ಆರ್ ಕಾಮನ್ ಥಿಂಗ್ಸ್ ವಿಚ್ ವಿ ರೆಗ್ಯುಲರ್ಲಿ ಸಿ ಆನ್ ದ ಡೈಲಿ ಬೇಸಿಸ್. ಅಂದ್ರೆ ಒಂದು, typically we all do this, where we sort of take shortcuts from the warm-ups or cooling downs. If the body has not warmed up properly, it can be a bit of aerobics, bit of stretching. Without that, when we start doing the activities, the muscles and tendons and ligaments will not be ready for that, and they get overstretched sometimes. Then what will happen is the muscle will start thinking something is wrong here. I have to protect myself and therapy. So what does it do? It goes into spasm. It becomes stiff. ಸೊ ಈ ರೀತಿ ಮಸಲ್ ಟೈಟ್ನೆಸ್, ಸ್ಟಿಫ್ನೆಸ್ ಆಗಿ ಬರುವಂತ ಪೇಷಂಟ್ಸ್ ಅನ್ನ ನಾವು ತುಂಬಾ ಕಾಣ್ತೀವಿ. That is one thing which is either due to not doing enough warm-ups and cooling downs, or it can be because sometimes people ಏನಾಗುತ್ತೆ, they would have not done activities for a long time. For example, now when the 10 years in that they wouldn't have done anything. Then suddenly one fine day they get an urge to go and start doing the things, which we all get. We all do that. One New Year day, one resolution or something like that, and we start doing the things. So when they try to do that kind of things, when the body is not ready for it, and suddenly you try to go high in the intensity part, then they are bound to get injuries. That is the second common category which I see. Third category is people who have been doing workouts on the daily basis, which is not wrong again, but there is something called cross training. Andre, if you are doing workouts, for example, if you go to the gym, you will know their trainers in martare, they make you do a leg day and telbetu. One day you will only do the back, only you will do the upper limb or shoulder day. So they classify that. But sometimes people try to do too much, and they will do the same kind of workouts all 7 days a week. Our same muscle, when you do it, push it every day after day, the muscle will not get a chance to heal the micro tears and micro injuries. That can accumulate and cause problems. So these are the common things which we see. And if apart from that, it can be just purely bad luck. But commonly we see these kind of things being the reason for that. Other than these simple things, sometimes kind of proper gear for the sports. Andre ಈಗ ಪ್ರತಿಯೊಂದು ಸ್ಪೋರ್ಟ್ಸ್ ಗೆ ಅದರದೇ ಆದ ಒಂದು ಫುಟ್ವೇರ್ ಇಂದ ಹಿಡ್ಕೊಂಡು everything has to be to the tailor made for that. ಆ ತರದ್ದು ಇಲ್ಲ ಅಂತ ಆದ್ರೆ, so ಆವಾಗ then if you are trying to just make do with certain things, then more likely to get injuries. So these are the common things. If we talk about the prevention part, we can talk all day just because on that one point, to be honest.
ಪರ್ಫೆಕ್ಟ್. ಅಂಡ್ ಆಲ್ಸೋ ಡಾಕ್ಟರ್, ಕೆಲವೊಮ್ಮೆ ಇಂಜುರೀಸ್ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಂದೇ ಎಕ್ಸಾಂಪಲ್ ಕೊಡ್ತೀನಿ ನಾನು. ಸೊ ನನಗೆ ನೀ ಇಂಜುರಿ ಆದಾಗ ಮನೇಲಿ ಏನ್ ಹೇಳೋರು, ಡಾಕ್ಟರ್ ಎಲ್ಲ ಬೇಡ, ಮನೆಯಲ್ಲೇ ಆಯಿಲ್ ಇದೆ, ಮಸಾಜ್ ಮಾಡಿದ್ರೆ ಒಂದು ವಾರದಲ್ಲಿ ಹೋಗ್ಬಿಡುತ್ತೆ ಅಂತ. ಯಾವ್ಯಾವ ರೀತಿಯ ಇಂಜುರೀಸ್ ನಾವೇ ಖುದ್ದಾಗಿ ಟ್ರೀಟ್ ಮಾಡ್ಕೋಬಹುದು, ಅಂಡ್ ಯಾವ ರೀತಿಯ ಇಂಜುರೀಸ್ ಗೆ ವಿ ಶುಡ್ ಅಂಡ್ ಮಸ್ಟ್ ಕನ್ಸಲ್ಟ್ ಅ ಡಾಕ್ಟರ್?
Yes, this is a very important question. We commonly have the dilemma in our mind as to when to see the doctor. And if there is an injury where you are struggling to walk or struggling to put weight on the leg, for example, or whenever you try to put a bit of weight on the leg, you feel like something is going to give away. Right? Under those circumstances, it is better to consult a doctor. So a lot of times we have abrasions. Andre ಒಂದು ಸ್ಕ್ರಾಚ್ ತರ ತುಂಬಾ ಸ್ಕ್ರಾಚ್ ಗಳಾಗಿರುತ್ತೆ, ಅಬ್ರೇಷನ್ಸ್ ಆಗಿರುತ್ತೆ. ಬ್ರೂಸಿಂಗ್ ಅಂದ್ರೆ ಒಂದು there will be a black area where there is a bit of bruising kind of thing. So ಅಥವಾ just a muscle stiffness where there is no other changes otherwise. Avaga it's not a wrong thing. See, applying a bit of oil and gentle massaging the muscle itself is not a wrong thing. But at the same time, that's not for everything. ಕನ್ನಡದಲ್ಲಿ ಒಂದು ಗಾದೆ ಇದೆ, ತಲೆಗೆಲ್ಲ ಒಂದೇ ಮಂತ್ರ ಅಲ್ಲ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. So we can't do that for everything, ಅಲ್ವಾ? So for certain things, absolutely, yeah, that can help. If it's a subtle muscle sprain ಎಲ್ಲ ಆಗಿದ್ರೆ ಸ್ವಲ್ಪ ಆತರ ವಾರ್ಮಿಂಗ್ ಕೋಕೋನಟ್ ಆಯಿಲ್ ಅಥವಾ ಏನಾದ್ರು ಹಚ್ಕೊಂಡು, then if you do a bit of stretching, muscle can relax. But if there is a ligament injury, if there is a fracture ಅಥವಾ ಏನಾದ್ರು ಮಸಲ್ ಟೇರು, ಜಾಯಿಂಟ್ ಒಳಗಡೆ ಏನಾದ್ರು ಇಂಜುರೀಸ್ ಆಗಿದ್ರೆ, ಆವಾಗ you have to seek for the help.
ಮತ್ತೆ ಈಗ ನನ್ನ ಒಂದು ನೀ ಅಕಸ್ಮಾತ್ ಸ್ಪ್ರೇನ್ ಆಯ್ತು ಅನ್ಕೊಳ್ಳೋಣ. So will I be able to walk, doctor?
There is a myth about this one, because a lot of people come to me and tell me that you are saying that I have got a ACL tear or ligament tear, doctor, but I'm able to walk. This happens because when there is only one ligament injury, and the rest of the joint is stable. See, ligaments don't take the weight. They don't bear the weight. Weight bearing is by the bones. The bone to bone support is what gives you the weight bearing. Ligaments are there to prevent sideward movements or rotational movements. So in spite of having a ligament injury, one will be able to walk. That will not be a problem. If there is a multi-ligament injury, like for example, road traffic accidents, we see that 2 or 3 ligaments are torn, the knee is in a very bad way, bad shape. Under those circumstances, one may not be able to walk. But when there is just one ligament injury, which has happened due to some sporting injury, some twisting, turning, then people will still be able to walk, and that's not wrong as well. They can walk. I'm not stopping them from walking. They may not be able to do any higher level activities, but walking itself is not wrong. If they can put weight on that and manage to walk, that itself is not wrong.
But wouldn't that aggravate the injury, doctor?
See, if the ligament is stretched or torn, that will be due to a particular angle in which it has been pulled and stressed.
Okay.
But that doesn't affect one. I mean, unless you go to the same kind of movement. Say, for example, ಈಗ ankle injury ಆಗಿದೆ ಅಂತ ಇಟ್ಕೊಳ್ಳೋಣ. Ankle ligaments ಏನಿದೆ outside of the inward buckle ಆಗ್ಬಿಟ್ಟು ankle ligaments injury ಆಗಿದೆ. So many times what happens is, if you again go and keep on walking on uneven surfaces or pavements, then there is a high risk that you can buckle it again. ಆ ಥರ injuries ಮತ್ತೆ ಮತ್ತೆ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ, ಆಯ್ತಾ? But if you are careful and if you are wearing some support for that and walking, that will not cause a problem. ಈಗ knee ಕೂಡ ಹಾಗೇನೆ. ಈಗ for example, knee ACL ligament will come into action only when you are doing sudden twisting movement with load on the foot. ಅದನ್ನ ಮಾಡಿದಾಗ ಮಾತ್ರ you may end up having an issue. But otherwise, you won't have if you are just walking, you're not going to tear apart anything further. A lot of places, people come in a big plaster for weeks together, then everything will become stiff. It will not be just that ligament. Everything will become stiff. This is one thing where sports injury specialists differ from probably other orthopedic surgeons in terms of how acute knee injury or acute ligament injury is managed.
And also, doctor, how will a person know that there is a ligament tear in his or her knee?
That can be very subtle sometimes. It may not be that simple sometimes. That's why people often come late to orthopedic surgeons as well. Because initially, ಸ್ವಲ್ಪ pain irutte, they are still able to put a bit of weight, they are managing the things. They sort of manage it to a certain extent, to a level. But whenever they do certain activities, andre ಈಗ sudden movement ಅಥವಾ steps ಹತ್ತಿ ಇಳಿಬೇಕಾದ್ರೆ, they will immediately feel that I'm not having the confidence which I used to have. So if that kind of thing is happening, then that means that the ligament is not working. You better consult a doctor. So that is one giveaway. But yes, I mean, there are other things as well, but that's one common giveaway.
And doctor, ಈ ಒಂದು arthroscopy ಅಂದ್ರೇನು? ಮತ್ತೆ ಇದರಿಂದ what are the benefits to a patient?
Yeah. So arthroscopy is something which is a next level of thing which we are doing, technological advance in terms of what we are doing compared to what we used to do as a conventional surgery. Because for two reasons. One, this is basically the thing where we use a camera and a scope to look inside the joint and do the thing. For two reasons. One, we can have smaller incisions, little chicken cut ಮಾಡ್ಬಿಟ್ಟು, through that we can pass the scope and enter into the joint, and to access the places which we couldn't have accessed easily before. So for example, to access the knee joint, if I put the camera, through the camera I can see almost the back portion of the knee without worrying. If I need to do as an open surgery, I will have to make a cut from here to here, and even after cutting that much, it's not easy to access the back portion of the knee or on this side of the knee. So with the camera and with the instruments which we use now, we can do a lot of work just through small cuts. So that is the one beauty of doing it through the scopy. And there are a lot of precision work we can do, which was not easy even with the open surgery. The learning curve is bigger for this one, because see, here you have to have the precision to access the right place and do it. In open surgery, if you can't see, in 2 centimeter extra cut, you will see. That's a different thing. But in this one, you have to have the precision to do it.
And even healing is very fast compared to open surgery, right?
Yes, in terms of skin healing and soft tissue healing, it is much better. However, overall rehab part will still take time. But with the proper rehab, people getting back to that level of fitness, even to go back to sports and active things, is possible with the scopy surgeries.
Perfect, doctor. And apart from arthroscopy, what other technological advances have happened in sports medicine?
In the past, we used to have metal screws for these things, suture anchors or metal screws we used to use, and that could have caused a lot of issues. Now we have got newer things, technology like bio screws, which are something which actually can become bone eventually. So that kind of things we use nowadays. For suturing some of the things like meniscus cushion in the joint only, or even in the shoulder joint, we repair certain things with what is called all sutures. All sutures ಅಂತ ಹೇಳಿದ್ರೆ there is not even a peg or nothing. It is just literally the suture itself goes into the bone, bunches itself, and becomes a flower and gets stuck there. So even if you pull it out, it doesn't come out, and then we can knot it and fix whatever we need to fix the things to the bone. Whatever cartilage agli, yavade agli, athwa meniscus agli, we can fix it back to the place where it belongs to. So that kind of sutures, that's the new technology which has come on. So we have got some custom-made instruments and implants which have come to picture now. So in the sense, there are some kind of deformed joints or problems where normal instruments don't even reach to those places. So for that particular patient, there are specific instrumentation which gets actually manufactured and the implants, so that it becomes a lot more easier for us to specifically use it for that particular patient alone. So there are newer things which are coming into picture. And we are also having some kind of scaffoldings which we are using, where the kind of, if you have got loss of cartilage or things, we are using artificial technology. Stem cell therapy is one of the part of the things which we have been evolving with now. So the areas where the cartilage was completely lost previously, the kind of things which we used to do was very minimal for that. We used to either do some little holes to grow a new cartilage over there. That's the kind of simple thing we used to do. Or sometimes we used to do cartilage, removing the cartilage from elsewhere and put it over there, those kind of things. But now with stem cell therapy, that's a next level of thing where we can cover a large area of cartilage loss without a problem. So ಈ ರೀತಿದೆಲ್ಲ ತುಂಬಾಷ್ಟು ಇಂಪ್ರೂವ್ಮೆಂಟ್ಸ್ ಆಗಿದೆ, and it's an evolving field, so there are more and more things coming out.
And after listening to these technological advances, doctor, one more I was just curious to know. You spoke about this suture where you punch it in and it becomes like a flower and you tie the knot.
Yes.
So adu alle permanent ಆಗಿರುತ್ತಾ ಅಥವಾ you will try to remove it, or how does that work?
ಮೊದಲೆಲ್ಲ ಏನಾಗ್ತಿತ್ತು, that used to remain permanently in the body. Now we are getting things which are partially again dissolved kind of things, and over a period of 2 years they will be there. Adad nantra they will gradually dissolve. So ಆ ತರ stitches ಬಂದಿದೆ ಈಗ.
And finally, ನಿಮ್ಮ ಒಂದು message to all sports enthusiasts and aspiring athletes who are watching the show right now.
Thank you. So simple words: stay safe, stay healthy, because health is wealth. At the end of the day, ನಾವು ಏನು ಒಂದು enthusiasm ಅಲ್ಲಿ we suddenly try to push the boundaries. Nothing wrong with that, but at the same time, you need to know your limitations, your body, what you have done so far and things. So if you look into that, and if you prepare, you can run marathon, you can run all the things. So a marathon can't be prepared for within a week. So I had people who came to me saying that I want to run a marathon next week. If you have not done anything for last 20 years and now suddenly if you want to run a marathon, it's not going to happen. So those things one needs to understand. And when you have some doubts in your mind that something is not right here, seek help. Stitch in time saves 9.
Perfect, doctor. So Dr. Naveen Kumar LV ಅವರು ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ಸ್ ಇಂಜುರಿ ಸ್ಪೆಷಲಿಸ್ಟ್, ಸೀನಿಯರ್ ಕನ್ಸಲ್ಟೆಂಟ್, ಮಣಿಪಾಲ್ ಹಾಸ್ಪಿಟಲ್, ಸರ್ಜಾಪುರ್ ರೋಡ್, ಬೆಂಗಳೂರು. ಇಷ್ಟೊತ್ತು ಇವರು ನಮ್ಮ ಜೊತೆ ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಜಾಯಿಂಟ್ಸ್ ಇಂಜುರೀಸ್ ಬಗ್ಗೆ ಸಾಕಷ್ಟು ಮಾಹಿತಿನ ಹಂಚ್ಕೊಂಡಿದ್ದಾರೆ. ಅಂಡ್ ಅವರು ಕೊಟ್ಟಿರೋ ಮೆಸೇಜ್ ಪ್ರಕಾರನೇ ನಮ್ಮ ಒಂದು ಬಾಡಿ ಕೆಪಾಸಿಟಿನ ಅರ್ಥ ಮಾಡ್ಕೊಂಡು ಲೆಟ್ಸ್ ಇನ್ವಾಲ್ವ್ ಇನ್ ಸ್ಪೋರ್ಟ್ಸ್ ಅಂಡ್ ಎಕ್ಸರ್ಸೈಸಿಂಗ್ ಆಕ್ಟಿವಿಟೀಸ್, ಅಂಡ್ ಲೆಟ್ಸ್ ನಾಟ್ ಟ್ರೈ ಟು ಮೇಕ್ ಅವರ್ ಬಾಡಿ ಓವರ್ ಡೆಲಿವರ್ ಅಂಡ್ ಫಾಲ್ ಇನ್ ಟು ಇಂಜುರೀಸ್. So having said that, thank you so much, doctor. We look forward to having many more such interactions with you in future. Thank you so much.
Thank you very much for having me.